Welcome to the deep dive. I'm your host, and really glad to have our expert joining us again as we get into a new set of source materials.
Happy to be here, ready to dig in.
So today's topic is one that, well, it affects a lot of people. The
Okay.
conservative management of chronic venous insufficiency. We've got this stack of sources, articles, guidelines, some research papers, covers quite a bit on vascular health.
Hmm.
But our mission for this deep dive is really specific. We're going through these sources to pull out the key insights on long-term conservative ways to manage this condition.
Right.
Think of it like building a practical roadmap directly from this material aimed at you, the listener, to understand how to manage CVI day to day and, really importantly, help avoid complications.
Exactly. We're cutting through the noise to find the core, actionable advice for conservative care, just based on what's in these documents, focusing on the non-surgical stuff, lifestyle, physical approaches.
Okay, perfect. Let's jump right in then.
Yeah.
Before we get to the strategies, how do these sources actually describe chronic venous insufficiency itself? Like, what's the basic problem?
Well, chronic venous insufficiency, or CVI, as it's often called, is basically a condition that affects the veins, usually in your legs. Putting it simply, it means the veins aren't doing a great job sending blood back up to the heart.
Against gravity, right?
Exactly. Gravity's working against them. And sometimes the little one-way valves inside the veins, the ones supposed to help push blood up, they get weak or damaged. So blood tends to pool, especially down in the lower legs and ankles.
And that pooling blood, what does that actually cause, according to what we're looking at here?
Well, that pooling leads directly to something the sources really emphasize as the core issue, chronic venous hypertension.
Hypertension, like high blood pressure, but in the veins.
Precisely. One document puts it very clearly, saying, chronic venous hypertension is accepted as the underlying pathophysiological cause of the skin damage.
Okay, so that high pressure inside the leg veins is what starts all the trouble, especially with the skin.
Yeah, think of it like a hose pipe that's kinked further down. The pressure builds up behind that point, right?
Mhm.
In your veins, that constant extra pressure forces fluid out into the surrounding tissues and starts causing changes, especially to the skin over time.
Chronic venous hypertension. Okay, that makes sense. High pressure where it shouldn't be, leading to downstream problems. So, if that's the root issue, what are the main conservative strategies these sources are highlighting for managing it long term? What's the first thing they talk about?
There are a few really fundamental things that come up again and again. One that's mentioned early and often, called a general measure that should be advised wherever possible, is actually pretty simple. Leg elevation.
Elevation, just putting your feet up. That sounds almost, I don't know, too basic for a chronic condition.
Well, it might sound basic, but the sources really position it as a foundational step because it directly works against that pressure we were just talking about.
Oh, okay.
By getting your legs up, ideally higher than your heart, especially when you're resting, like sitting or lying down, you're basically using gravity to help the blood flow back up.
Right, giving the veins a hand.
Exactly. It helps reduce how much blood is pooling down there and temporarily lowers that venous pressure. It's not a cure, obviously, but the sources point to it as a really practical way to ease some of the symptoms caused by that pressure, like swelling. Just giving your veins a break from fighting gravity constantly. It's a simple habit, but clearly important based on this material.
Okay, so actively using gravity to help out, that's elevation. What else really stands out as a sort of cornerstone of conservative management in these sources?
Oh, without a doubt, compression therapy. This is mentioned repeatedly as crucial, maybe even the most important general measure. The sources really stress the need for effective compression.
Compression therapy, we hear that term quite a bit. What does effective compression actually mean here, and why is it considered so central?
Effective compression, as it's described or implied here, means putting external pressure on the limb, usually the lower leg and ankle.
Hmm?
This pressure helps push back against the outward pressure from the veins, that venous hypertension, and it supports the vein walls themselves. It's like wearing a supportive sleeve, helping the valves work better and stopping fluid from leaking out into the tissues as much.
And the why. You mentioned it links to complications.
Yes, the why is deeply tied to preventing the main complication these sources talk about quite a lot, which is venous leg ulcers.
Oh, right.
One source is really specific about the long-term role here. It says, long-term compression therapy should be considered to reduce the risk of ulcer recurrence for patients who've already had ulcers that healed.
Wow, okay. So it's not just for when things are actively bad, but it's actually a preventative measure against serious future issues. Ulcer recurrence sounds like a major concern in this material.
It absolutely is.
Yeah.
Venous leg ulcers are described as these slow-healing, often quite painful wounds that can really impact your quality of life. The sources link them directly back to that chronic skin damage caused by the long-term venous hypertension. So consistent long-term use of effective compression is really presented as a primary defense strategy in these documents. It helps keep that damaging pressure more controlled and protects the skin from breaking down, especially if you've had ulcers before.
So compression is key, especially long-term, to try and stop these venous leg ulcers. What kinds of compression therapy are actually mentioned in these sources? What might someone actually use?
The material lists a few different forms. The most common ones mentioned are compression bandages. These are often used maybe more initially, perhaps if there's a lot of swelling or during the healing of an active ulcer.
Okay, bandages first, maybe.
Then there's compression hosiery, which is also called elastic compression stockings. These are probably what most people picture the garments you wear every day.
Right, the stockings.
The sources also mention adjustable compression garments. These often use things like Velcro or zippers, making them potentially easier to put on, allowing the pressure to be adjusted a bit.
That sounds useful. Easier to manage, maybe.
Potentially, yeah. And there was one other type mentioned, IPC.
Yes, intermittent pneumatic compression. The sources describe this as more of a specialized option. It's typically considered when other compression options are not available, cannot be used, or have failed.
So not the first thing you try, generally not based on this. It involves a device like cuffs that wrap around your leg, and they inflate and deflate in cycles. It gives this sort of mechanical squeezing action to help push blood flow upwards. It's presented here as an alternative approach for specific situations.
Okay, so you've got the daily wear, things like stockings and adjustable garments, bandages for maybe more acute situations, and then this IPC device as a backup plan, kind of. It sounds like different tools for different jobs, but all aiming for that external support.
Precisely. The goal is the same: apply that helpful external pressure, but the methods vary, which allows for some flexibility depending on the person's needs and the specific clinical picture, as the sources seem to suggest.
I also noticed something interesting in the sources about using compression, even if someone has other circulation problems, like arterial issues at the same time. Can you explain that bit from the material?
Yeah, that's a really important point the sources raise about, well, complexity. They indicate that compression can still be helpful even with mixed arterial and venous ulcers.
Meaning problems with both the arteries bringing blood down and the veins bringing it back.
Exactly. Problems with both systems contributing to the wound. But, and this is a critical but they add, compression therapy in those cases should only be used if the arterial circulation is still good enough.
Oh, good enough? How?
They specify a threshold based on something called the systolic ankle pressure. It's a measure of the arterial blood flow down at the ankle. They state it needs to be above a certain level. 60 mmHg is the figure given.
Why is that number important? What happens if it's too low?
Well, if the arterial pressure is too low, if blood isn't getting down to the foot properly through the arteries, then squeezing the leg with compression could actually make things worse. It could further restrict that already poor inflow and potentially cause harm, like tissue damage.
Ah, okay. That makes complete sense.
So that detail in the sources really highlights that while compression is super important, it has to be applied carefully, especially if other vascular issues are going on. It underlines that a doctor or nurse needs to check your circulation properly before recommending compression, especially these more complicated mixed ulcer cases.
Right. Making sure the treatment fits the whole circulatory picture. Okay, so just to recap the main conservative strategies from these sources, definitely elevation when resting, and then consistent effective compression therapy using things like stockings, bandages, or maybe those adjustable garments. And IPC is another possibility, and always being mindful of the overall circulation.
Yes, that really captures the core daily management approaches outlined in these particular documents.
Now, let's go back to that complication you mentioned, venous leg ulceration. How serious is this problem, based on what these sources say?
Well, as we touched on, venous leg ulcers are definitely presented as a significant, often debilitating consequence of that long-standing venous hypertension. They're described as chronic wounds, usually near the ankle area, that can be painful, get infected easily, and take a very long time to heal.
That sounds rough.
It is. And the sources specifically mention patients at different stages. They talk about those with healed venous leg ulceration.
That's the C5 thing you mentioned.
Right, sometimes called CEAP, clinical class C5 in medical terms. And they also talk about those with active venous leg ulceration, which is the C6 classification.
Okay, so C5 means it's healed over, C6 means there's an open wound right now.
Exactly. Those are just clinical ways to describe it. But for you, the key takeaway is that these ulcers represent the skin barrier actually breaking down because of that relentless pressure from the veins not working properly.
And that's why prevention is so key.
Absolutely. Preventing them in the first place, or stopping them from coming back if one is healed, is a primary goal of all these conservative measures, according to this material. The impact on just daily life, getting around comfort levels when you have an active ulcer is huge, which is why the sources put so much emphasis on that long-term compression for both prevention and management.
It really drives home the importance of these daily steps. They're not just about feeling a bit better, but about actively trying to prevent a really serious problem. Now, are there any other measures or approaches mentioned in these sources? Maybe things that aren't the daily compression or elevation, but still relevant to managing the condition or avoiding complications?
Yes, while our focus is definitely the conservative daily roadmap, the sources do acknowledge that sometimes medical procedures can be part of the picture, especially when it comes to tackling the underlying factors that lead to complications like ulcers.
Okay, like what sort of procedures are mentioned?
They briefly touch on interventions that target something called superficial venous reflux or superficial venous incompetence.
Superficial,
Yeah.
meaning the veins closer to the skin.
Exactly. It refers to when the valves in those surface veins aren't working right, allowing blood to flow backwards, which contributes to the high pressure and skin damage lower down. The sources mentioned that treating this superficial problem with procedures like ultrasound-guided foam sclerotherapy,
Which is like injecting something into the veins?
sort of, yes, a
Okay.
special foam to close it off, or things like endovenous thermal ablation, which uses heat, like laser or radiofrequency, inside the vein to seal it shut. The sources say these have shown clinical advantages.
What kind of advantages specifically?
They note improved healing of venous leg ulcers and, importantly, lower rates of recurrence, the ulcers coming back when these underlying superficial vein problems are fixed. And interestingly, they mention this benefit holds true even if there are also issues in the deeper veins.
Ah, so fixing the surface vein problems can make a real difference for the ulcers, even if deeper veins are also involved.
That's what the sources suggest, yes.
So, the material points out that while elevation and compression are your daily tools, sometimes a doctor might recommend a procedure to fix a specific faulty vein as part of a bigger plan, because it helps tackle the root cause of the pressure damaging the skin and causing those ulcers. It's good they include that perspective.
Right. It shows that managing CVI effectively, and especially preventing ulcers, might involve combining different strategies that consistent conservative care every day, potentially layered with targeted procedures to address specific vein issues found by a doctor, all aimed at getting that damaging venous pressure down.
Okay, great. Let's try and pull this all together then into that roadmap we talked about. Based purely on these sources, what's the essential takeaway for someone managing chronic venous insufficiency conservatively, aiming to avoid complications like ulcers?
Cool. Based on this deep dive into the source material, the essential roadmap for conservative CVI management really rests on two main pillars. First, consistent leg elevation whenever you can during periods of rest.
Okay, pillar one, elevation.
And pillar two, dedicated long-term use of effective compression therapy, whether that's stockings, bandages, or adjustable garments. The sources make it very clear these steps are fundamental. They're crucial for managing the symptoms caused by that high venous pressure and, really critically, for reducing the significant risk of developing venous leg ulcers or having them come back.
So it's about building these habits into your daily life.
Exactly, making them a consistent part of your routine to support your veins and protect your skin over the long haul.
It really emphasizes that even though CVI is a chronic thing, there are concrete actions you can take every single day, supported by this medical material, that can genuinely make a difference in managing it and, hopefully, avoiding its most serious outcome.
Absolutely. It just underscores the power of these foundational measures in lessening the impact of chronic venous hypertension on your health and your quality of life, which is a theme running right through these documents.
Well, this has been an incredibly useful exploration of what these sources tell us about conservative management for chronic venous insufficiency. We've seen how they frame the problem around venous hypertension, really focused on the key roles of elevation and compression.
Especially compression.
Right, and understood why preventing venous leg ulcers is such a major goal of these strategies, while also acknowledging, based on the material, how procedures can sometimes fit into the picture.
It gives a pretty clear view of the non-interventional approaches that are emphasized in this particular set of sources.
It does, and it kind of leaves us with a thought, doesn't it? If consistent, seemingly simple daily habits like putting your feet up and wearing compression can have such a significant impact on a chronic condition like CVI? Well, it makes you wonder, how might applying that same kind of steady focus to other aspects of our health unlock similar, maybe unexpected
That's
benefits?
a powerful question to reflect on.
Data.
Um,
Thank you so much for joining us on this deep dive. We really hope this look into the source material gives you a clearer understanding and a practical roadmap for the conservative management of chronic venous insufficiency.